Welcome to our channel. Today we'll be diving into an important health topic that affects millions of women worldwide: vaginal candidiasis, also known as a yeast infection. If you've ever experienced itching, discomfort, or a thick white discharge down there, you might be dealing with this common condition. But what exactly is vaginal candidiasis? What causes it? And most importantly, how can it be treated or managed at home? Stay tuned as we explore all you need to know about this topic, from causes and symptoms to treatments and home remedies. We'll also answer the most frequently asked questions to help you feel more informed and empowered about your health. Let's start with the basics. Vaginal candidiasis, commonly known as a yeast infection, is caused by an overgrowth of a type of yeast called Candida albicans. Normally, this yeast is present in small amounts in the vagina, mouth, and digestive tract. But when something throws off the balance of the vagina's natural bacteria, the yeast can grow too quickly, causing an infection. This condition is incredibly common, with approximately 75% of women experiencing it at least once in their lives. Common symptoms: intense itching in and around the vagina, thick white discharge that looks like cottage cheese, burning sensation, especially during urination or intercourse, redness and swelling of the vulva, pain or discomfort during sex. Now that we know what it is, let's take a look at the causes. The yeast that causes vaginal candidiasis is always present in the body. So what causes it to grow out of control? Several factors can contribute to the disruption of the natural balance in the vagina. 1. Antibiotic use. Taking antibiotics, especially for a long time, can kill off good bacteria in the vagina, allowing candida yeast to flourish. 2. Hormonal changes. Pregnancy, menstruation, birth control pills, or hormone replacement therapy can cause changes in hormone levels that encourage yeast growth. 3. Uncontrolled diabetes. Women with poorly controlled diabetes tend to have higher levels of sugar in their body, which can feed the yeast and make infections more likely. 4. Weakened immune system. Conditions like HIV/AIDS, taking steroids, or undergoing chemotherapy can weaken your immune system, making it harder for your body to keep the yeast in check. 5. Tight clothing and poor hygiene. Wearing tight, non-breathable clothing like nylon underwear or tight jeans can trap moisture, creating an ideal environment for yeast to grow. 6. Douching. This can upset the natural balance of bacteria in the vagina, making you more prone to infections. 7. Stress. High stress levels can weaken the immune system and affect the body's ability to maintain a healthy yeast balance. Now let's discuss how to treat vaginal candidiasis. Fortunately, it is usually easy to treat, either with over-the-counter medications or through a doctor's prescription. The treatment plan depends on the severity of your symptoms and whether it's a recurring issue. Creams and ointments. Available without a prescription, these include antifungal medications like clotrimazole or meconazole. They can be applied directly to the affected area for quick relief. Suppositories. Antifungal medications inserted into the vagina, often used for 1 to 7 days, depending on the product. Oral antifungals. If over-the-counter treatments don't work, your doctor may prescribe an oral antifungal medication like fluconazole, diflucan. It is usually taken as a single dose but can be repeated if necessary. Topical steroids. In cases of severe itching or swelling, your doctor might prescribe a mild topical steroid cream to reduce inflammation. If you have recurrent yeast infections, which means more than 4 times a year, your doctor may recommend a longer treatment course, sometimes up to 6 months of antifungal therapy. In this case, lifestyle changes are often suggested to help prevent future infections. Now let's talk about home remedies. While medical treatments are highly effective, some women prefer to try natural remedies in conjunction with or in place of antifungal medications. Taking probiotic supplements or eating foods like yogurt that contain live active cultures of Lactobacillus acidophilus may help restore the natural balance of bacteria in the vagina. Coconut oil has antifungal properties. Applying a small amount of coconut oil to the affected area may help alleviate symptoms. Diluted tea tree oil applied to the affected area is sometimes used for its antifungal properties. However, this oil can be very potent, so it's important to dilute it with a carrier oil to avoid irritation. Some women find relief by consuming garlic, which has antifungal and antimicrobial properties. However, inserting garlic directly into the vagina is not recommended, as it can cause irritation. Boric acid has been shown to be effective against yeast infections, especially in cases where traditional antifungal treatments don't work. However, it must be used carefully and never orally, as it can be toxic. Opt for loose-fitting clothes and cotton underwear to help keep the vaginal area dry and reduce the risk of infection. Avoid using douches, scented soaps, or feminine hygiene sprays, as they can upset the natural balance of bacteria. Before we wrap up, let's address some of the most frequently asked questions about vaginal candidiasis. Yes, it's possible, but rare. Yeast infections are not classified as sexually transmitted infections, but you can pass the yeast back and forth with your partner, especially during unprotected sex. Yes, men can develop yeast infections on their genitals, especially if their partner has one. This is called balanitis and can cause itching, redness, and irritation of the penis. In mild cases, some yeast infections may resolve without treatment. However, it's always best to seek treatment, as untreated yeast infections can cause more severe symptoms or lead to other complications. Yes, but you should consult your healthcare provider first. Most over-the-counter topical treatments are safe during pregnancy, but oral antifungal medications like fluconazole are usually avoided. To prevent future yeast infections, wear loose-fitting cotton underwear. Avoid using scented soaps or douches. Take showers instead of baths. Change out of wet swimsuits or sweaty workout clothes immediately. Consider taking probiotics if you are prone to infections. So there you have it, a complete guide to vaginal candidiasis. From understanding the causes and symptoms to exploring treatments and home remedies, we hope this video has given you the knowledge you need to take control of your health. If you're experiencing persistent or severe symptoms, always consult with a healthcare professional to get the proper treatment. Don't forget to like, share, and comment on this video for more informative content on women's health. And feel free to drop your questions in the comments below. We'd love to hear from you. Thank you for watching and take care of your health.